Our next presenter is Dr. Ekwaro Obuku, who is going to present to us about priority setting for health systems research in Uganda.
Thank you very much. I'm delighted to be here. I'll keep it brief. Basically, what we did was to try and assess how we can identify priorities for health systems research in a way that was scientific, but also involving decision makers. And this was a poster which we have presented in previous work. So this is the background. Stakeholder involvement in priority setting may enhance the use of research in decision making. And this is what we did as the so-called Africa Center, which is based at Makerere University. Our objective was to identify priority questions for health systems evidence synthesis, and our method was really selecting decision makers purposively from different interest groups, and then 29 researchers. And then we presented them with the background documents to read. And some of them were priority topics for low-income and low and middle-income countries from what we call the Norwegian EPOC group. This is a Cochrane group looking at issues affecting low and middle-income countries such as maternal health. And then the WHO health systems perspective at that time, looking at the 6 blocks, and then the MDGs, child health, maternal health, and infectious diseases. So what we did was to say, okay, what do decision makers want to know? And what evidence is available? And to look for that evidence, we went to a search engine, not Google. It is called PDQ evidence. PDQ stands from pretty darn quick. Pretty darn quick. It's supposed to be the Google for decision makers, because most decision makers will go to Google. So Cochrane, of course, is very complicated for non-clinical researchers. If you tell a policy maker, the Director General of Health Services, that you go and look at it, it's in Cochrane, I think he'll get lost. So this pretty darn quick is one area which looks at policies, policy-relevant research. And the outcome measure was to say, what are those 10 most important priorities the decision makers will come up with? And we ranked them as, is it important? Is there available relevant research to support it? Is it a viable option? Is there uncertainty? Because people may use research if they don't know what steps to take. Is there uncertainty? We don't know which works or which doesn't work. Is there opportunity for change? Right now we can see there's opportunity for change, yeah, in as far as health insurance is concerned. And then is there interest in deliberation? Everybody, even in the taxi, they are talking about health insurance, for instance. So the participants identified the 34 priority areas. There were delivery arrangements mostly, followed by financial arrangements and organizational arrangements. So there were 34 priority, at least 34 of them. And then when we ran the second and third round, because this was an iteration, we discovered that the most important were around financing, something to do with financing, something to do with allocation of resources. And what was very interesting is that there was actually evidence out there already. We didn't need to go and look for research. For example, we found that there were existing overviews, 8 of them. People had already done primary research, done systematic reviews, and people had even summarized those systematic reviews, 8 of them in those topics. And there were 23 systematic reviews. So this is the table really looking at those, the results table. And these are the institutions that participated: Ministry of Health, National Drug Authority, National Health Consumers Organization, Children's AIDS Fund. These were non-governmental, and research institutions in Africa and outside Africa. And these are the results. In the next, do I have 2 minutes more or something? How much time? I have 2 minutes, I'm told. So in the next stage, we did it in 2 stages. The first stage was in 2014, 2014, the next one was in 2015. We did the same. We now zeroed on the issues that were important, and we focused now on health insurance. And I just wanted you to look at this table. This is, I think, the most important result. We ran this model again, and what were the most important things that the stakeholders thought about the health insurance? One was the governance and accountability in the third iteration, number 4. We're talking about Uganda Manufacturers Association, we're talking about Employers Federation, and so on and so forth. Then they were concerned about the range of benefits. You see, the initial law was provided a schedule of you shall not get dental surgery, you shall get that kind of thing, and it became very confusing. That is the 2012 bill. And then, of course, the tax regime and how it will be paid for. There were about 15 policy concerns which we came up with, and we thought those should be addressed. So our conclusion was that our interim findings suggested the following key policy concerns: range of benefits accruing to users, affordability of the scheme, how health service providers will be paid, and governance of the fund. Actually, in the third iteration, which I didn't show there, was ranking high. And what was very important also is that there was available evidence to inform this decision, but the decision makers did not know that this evidence was available, neither did researchers know. They are continuing to do research and contributing to the research waste. Thank you very much.
Thank you very much. A clap for Dr. Obuku.